If I don't have a family history of breast cancer, I won't get it.
Most people diagnosed with breast cancer have no family history. Less than 25% of breast cancers are inherited. The vast majority of patients who get breast cancer do not have a family history of breast cancer, suggesting that other factors must be at play, such as environmental factors and lifestyle factors. The biggest risk factor for getting breast cancer is being a female and getting older. Healthy breast cells over time can mutate and develop into cancer cells. If you have a strong family history of breast cancer, meaning one or more first-degree relative that has gotten breast cancer, definitely share that information with your doctor.
If you maintain a healthy weight, exercise regularly, eat healthy, and limit alcohol, you don't have to worry about breast cancer, right?
Although these behaviors can help lower breast cancer risk, they don't completely eliminate it. We hear it so often from our patients that they have been eating healthy, exercise all the time, and barely drink any alcohol. So how did they end up getting breast cancer? It's certainly helpful managing the risk factors you can control, but it's still important to get regular screening mammography, perform self-breast exams, and pay attention to changes in your breasts. I think the heavy focus on lifestyle and environmental factors can be misleading, since most breast cancers are caused by factors outside of our control.
Wearing an Underwire bra or deodorant can cause breast cancer.
There is no evidence that underwire bras can cause breast cancer. There are rumors that the chemicals in aluminum in deodorants are absorbed into the lymph nodes and make their way into breast cells, increasing cancer risk. Another theory is that deodorants stop the underarm sweating and prevents the release of toxic substances from the underarm lymph nodes, increasing cancer risk.
Annual mammograms guarantee that breast cancer will be found early.
Although mammography is the best early detection screening tool we have, it's not a perfect study and may not pick up all cancers, particularly in patients with dense breasts. Although mammography is a very good screening tool, it isn't foolproof. Mammography does catch most breast cancers, and that's why regular screenings are essential, but it can return a false negative result, meaning that the images look normal even though cancer is present. It's estimated that mammograms miss about 10 to 15% of breast cancers at the time of screening. It's also important to pay attention to any changes in your breasts, perform monthly breast self-exams, and to have a physical examination of your breasts by a health professional every year.
Breast cancer always shows up as a lump that you can feel.
Breast cancer may not always present as a lump when it first develops. People are sometimes under the impression that breast cancer always causes a lump that can be felt during a self-exam. They might use this as a reason to skip mammograms, thinking they'll be able to feel any change that might indicate a problem. However, breast cancer doesn't always present as a lump. By the time it does, the cancer might have already moved beyond the breast to other parts of the breast and/or lymph nodes. Although performing breast self-exams is certainly a good idea, it isn't a substitute for regular screening with mammography.
All breast cancers are treated the same way.
Treatment plans vary widely depending on the characteristics of the cancer and patient preferences. Many people have some vague idea that breast cancer requires some combination of surgery, radiation therapy, and maybe chemotherapy, but they don't know much beyond that. Some of the different factors that come into play include size, stage, and the grade of the cancer, as well as the location. Additionally, whether or not the cancer is an inherited genetic mutation, such as BRCA1 or 2, the ER, PR, HER2 status, and patient preference about avoiding specific side effects, or the timing of treatment sessions. Breast cancer only happens to middle-aged or older women.
Younger women can and do get breast cancer, as do men. It is true that being female and growing older are the main risk factors for developing breast cancer. But women of all ages need to perform self-exams and report any unusual changes to their doctors. It's okay to insist that breast cancer be ruled out if you have a concerning symptom. Women with strong family history of breast cancer, especially with relatives diagnosed before the age of 40, may wish to have screening exams sooner, sometimes starting in their 20s or 30s. Changes in male breasts need to be checked out too. People mistakenly think that men don't have breast tissue and often don't think about breast cancer when changes or lumps occur. While male breast cancer accounts for less than 1% of all breast cancer diagnosed in the US each year, it tends to be diagnosed at a more advanced stage. It is important to see your doctor at any age, male or female, to address breast issues as they arise.